Whenever you take an early action, whenever you take an early action, you can save one life. That's the matter here. ये अगर तुम सीख रहे हो, जैसे भी टाइम है, तुम आपके पास एक आदमी बेहोश हो गया है. I will teach you what to check first. I will teach you, but whenever he is unconscious, you can do so many things to save him. You have a time. There is no need that you should wait for a doctor or a nurse to come to the site. Before that, you can do so many things. Okay, so today I will give you the training also, and also teach you what to do when it comes to an emergency in the site. Okay, and the third point is anyone can perform BS. There is no need of MBBS degree. There is no need of BSc nursing. Any kind of medical background is not needed for BLS. Okay. So, first thing is, whenever we are taking a patient, we have to see the vital signs. Vital signs means basic things like BP. BP of the patient is very important. Then the next thing is the pulse. We have to check the pulse. Then comes the breathing and circulation. For example, if a person is unconscious in your side, okay, I'm taking this person as an example, okay, is okay, fine, okay. Keep this head like this. Now you just breathe. Is it comfortable for you? Yeah. Or now breathe. Which one is comfortable? ये है ना ज़्यादा comfortable. So the first thing is, whenever your patient is in your side, is unconscious, his head will be like this, anything. Okay, he will be not in the straight position. बेहोश होने वाला ऐसे नहीं तो सोने वाला. Okay, so you have to check three things. The first thing is breathing, then the circulation, and also his pulse and BP. And you know where we can see the pulse? Can anyone say me? Can anyone answer? Yes. Where? Here. Listen. Can you come? Yeah. Yeah. This is the one place we can check the pulse. Everyone, you can check your own. And the one mistake that everyone do is everyone will check with this. Right? सब ऐसे देखते हैं. ऐसे देखने में क्या प्रॉब्लम है कि इधर एक आर्टरी जा रहा है, ठीक है, ये आर्टरी इधर से कनेक्टेड है, तो आपका जो पल्स है वही मिलेगा. आपको पेशेंट का पल्स कभी नहीं मिलने वाला. अगर आपको पेशेंट का पल्स मिल रहा है, use two fingers. These two fingers. This only gives you the accurate pulse of the patient. If you give the thumb finger, you will get your own pulse, and that will be not needed during the time of emergency. First thing you got it. The first pulse will be radial pulse. The second pulse is carotid. You can check your own. Okay. See, theories are okay, but the practical is different. So you can check your own because I can't give you come and check here. We don't have such time. I will finish this class within 1 hour. So the second pulse you have to check here. You can don't speak. Just keep the hands here. You can feel the pulse here. This is known as carotid pulse. So whenever a patient is unconscious, you have to check two pulse. First is this peripheral pulse, this radial pulse. The second one is the carotid pulse. These two pulses are very important when the patient is unconscious. The second thing is breathing. You have to check the chest. Check the chest. If the patient is normally breathing, you can see the chest movement, right? You can see the chest movement. If there is no chest movement, you can confirm that the patient is not healthy. That's a sign for CPR on the BLS support in the site. The second one, no response when called. Usually we will go to the patient, go to the person and we will call like this. Sir, are you okay? Strongly. Not SNA. Sir, Nico, SNA. Strongly. Sir, are you okay? If with this he will respond, his response means okay, he is responding, he does not need a CPR that time. Okay, but why this he is not responding, then you have to be careful that he is in an emergency situation. Or else in a cardiac arrest or severe injury. For example, bleeding. कभी कभी साइड में क्या होता है, ब्लीडिंग हो जाने की वजह से हाइपोवोलेमिक शॉक है पेशेंट इन द विल गो. बॉडी में रिक्वायर्ड अमाउंट ऑफ ब्लड नहीं है तो पेशेंट क्या होगा, हाइपोवोलेमिक शॉक बोल के स्टेज होता है, उसमें निकल जाए, मींस दैट विल कॉज टू कार्डियक अरेस्ट. सो these things you should keep in mind. The person should be conscious, whether he is conscious or not, whether he is breathing, whether he is having pulse or carotid and radial pulse. Then you can come to a decision whether this person requires CPR or not. You have to keep the scene safety first. Scene safety means for both the patient and also for the who is giving the BLS. First thing is that. And second, check the response. That's what I told. Go and check. Tap the shoulder, shout and tap. That means, are you okay? Are you okay? That आपके भाषा में आप बोल सकते हैं. The second is call for the ambulance immediately and also call for the help. That means after you have recognized that you have आपको आप समझ गए patient जोश हो गया है, it's an emergency. You can start CPR. Before that, you can take and help from anybody and inform first aider, ambulance, and the necessary authorities. Got it? And ask someone to bring AED. This thing we don't have here. Comes for the CPR. CPR has some rules you have to take care of. The first thing is you have to push hard and fast. Okay? It's not like no. It should be hard and fast. And also you have to give at least 100 to 120 compression per minute. That's just how the 30 to 35 CPR you have to give and 2 breaths like that. पहले बोलते थे मुंह से मुंह दे सकते हैं, लेकिन as per the new ICMR rule we cannot give mouth to mouth because if this person is having any kind of infection, you will go also get the infection. So that's why we are using a named equipment called ambu-bag that I will show in the picture also. So that's why we will not give mouth to mouth breathing. Instead of that, we will give 5 to 6 centimeters. Okay? Next. Here comes the what I told you about the breathing. Before giving breathing, as I told, the person will be like this. Hope you have kept the person like this. The chin should be lifted like this. Why? Because when the person is like this, he cannot breathe because his airway is blocked like this. It's blocking. You cannot breathe. When the head is proper, you can take a proper breath. So chin should be and head should be tilted and chin should be lifted. Then only we have to give the oxygen support to the patient. Then only he will get proper air circulation to the legs. Got it? Yes. Then, okay, you have to watch the chest rise. While giving the oxygen support, you can see the chest rising. Okay. Then next is 200. Okay, that's all. जाता है तो चोकिंग होता है. चोकिंग की वजह से क्या होता है कि जो खाना पेट में जाना चाहिए वो लंग्स में निकल जाता है. जब लंग्स में चला जाता है क्या होता है? ब्रीथिंग डिफिकल्टी शुरू हो जाता है. जब ब्रीथिंग डिफिकल्टी शुरू हो जाता है तो पेशेंट्स ऑक्सीजन लेवल भी come down and he will go to a cardiac arrest. Okay, you will think that इतना छोटा सा जो बाल का lungs में नहीं. When a food goes to your lungs, it will interrupt your oxygen flow. If the oxygen flow interrupts, your brain will not work, and slowly in whole body the oxygen level will come down, and it may cause a certain life-threatening condition like cardiac arrest. So in such cases, you have to help the person. For example, see my thumb, and it is here, his sternum bone here. You have a bone here, right? Center of this way, you have a sternum bone. Below to that, here, this area. Below to that, you have to keep your hand here. You have to support, and like this, you have to give the support. I am giving slowly only because he is alive. Okay, he is okay. Otherwise, I could have given properly. So, just for your knowledge, I am giving. You have to give this support. See my hand. This one I am keeping here. This one here, and I am like this. Like this, you have to push so that the interruption should be gone. Okay, that's what shocking. So electric shock, as you know, switch off the power first. If it is a severe bleeding, you have to stop the bleeding by applying a pressure at the site. Because of the blood losses from the body, then the patient will have a hypovolemic shock. Means if the blood losses, he will go to a shock condition. It's a medical term. So that will also cause a cardiac arrest. It's like this cupping form. Okay. It does not hurt him. If you beat like this, what happens? He is having breathing difficulty. It's a nervous area, spine. Okay, should not beat like this. It's a cupping. There do a pain? No. If I beat like this, surely it will hurt him. So it's not like that. So it's cupping form and you have to help him like this. It's okay. Okay, next one, it's the blows. Then comes to the abdominal thrust that I shown you before. Okay, do the necessary calling ambulance, calling first aider, doctors, anyone. Okay, if you start CPR, it's good. Okay, next is early, as I told you, early CPR, save the life. If you start CPR early, it will save that life. There is no need to come doctor first come there and then you only have to start the CPR. No, you can start. Your action can save life. Okay, so theory classes are over. go and tap on the shoulder and call his name and ask whether are you okay. If he is not responding, then you call for help. Help, ambulance, first aider, then inform. There will be so many persons. You can tell someone, and call ambulance or call first aider. And what you can do, you have to check the pulse. If there is no pulse, no response, no doubt, you can start the CPR. So we have to 30 compression. You have to count on your mind 30 compression. After 30 compression, what should you do? You have to give the oxygen. If we don't have the oxygen, you can do after 30 compression. Wait, check the pulse again. If there is no pulse, again start the compression. So after every 30 compression, you have to check the pulse. If you don't have other accessories like I say ambu bag like oxygen or a defibrillator, just go for a continuous CPR. Hope you got it. So that's the theory class now. We will be using this side to compress here. And आपका जो chest area है, just turn up उनके नीचे इधर compression देते हैं, ठीक है? इधर देते हैं. So this should be like this. And the second thing is ऐसे CPR कोई नहीं देता. देख लो मेरा हाथ कैसा है. ऐसा कभी CPR नहीं देना चाहिए. Hand should be straight. आप जैसे मैं खड़ा हूँ ऐसे नहीं होता है. ऐसे आना चाहिए. मीन्स पेशेंट के ऊपर आपका बॉडी वेट आपका हाथ के ऊपर आना चाहिए और ये दो हैंड्स जो हैं वो क्या होना चाहिए स्ट्रेट होना चाहिए. ऐसे सीपीआर देने से भी अच्छा है वो मर जाए. ठीक है, ऐसे देने से कोई फायदा नहीं है. ओके, सो योर हैंड शुड बी लाइक दिस एंड योर वेट शुड बी लाइक दिस. देन बॉडी
अगर कोई भी आदमी साइड पे आप देख रहे हैं कि बंदा कोई रेस्पॉन्स नहीं दे रहा, बैठा इसे झूक गया, तो इसे जाके उठा के ले जाके इसे स्टार्ट नहीं कर देना है. सर ने 2-3 बार बोला उनको, वहां से उठा के लेवल वाला जहाँ जमीन है बढ़िया है लेवल है वहां लिटाइए. लिटाने के बाद उसका जो सर बोला है चेक करने का, उसका पल्स चेक कीजिए चल रहा है नहीं चल रहा है. उसके बाद आपने उसको थपथपाया, राहुल मिठू जो भी नाम है वो कोई रेस्पॉन्स नहीं दिया, उसके बाद ही आपको चीज स्टार्ट करना है. ऐसा नहीं है कि कोई बंदा कुछ दूसरे बीमारी के चलते ऐसा हुआ वो और आप CPR स्टार्ट कर दिए तो दूसरा ही कुछ लग जाएगा. तो इसके लिए हमने इनको आया, सबसे पहले देखा कि हाँ ये तो एक गड्ढे वड्ढे के साइड में है, इनको यहाँ से उठा के मैंने लेवल वाले जमीन पे भाई को बुलाया. भैया अकेले तो बंदा उठेगा नहीं, साथ वाले को बुलाया, अच्छी जमीन पे लेटाया. वहाँ लेटाने के बाद में इनको मैं धक्का राहुल भाई पूछा, ये बंदा कोई हमको रिस्पॉन्स नहीं दिया. फिर मैंने इसका अपना चेक किया, पल्स चेक किया, हाथ से चेक किया, गले में दोनों उंगली लगा के देखा कोई रिस्पॉन्स नहीं दे रहा है. तब हमको साथ साथ वहां से अपने फर्स्ट एडर या कोई सीनियर पर्सन है उनको बताना है कि ये कोई बंदा रिस्पॉन्स नहीं दे रहा है. इसके बारे में आपको जानकारी है तो मिनटों का ही काम है. अगर समय का बचत आप कर लिए, उस बंदे का जान बचा लिए, तो समझिए कि आपने वो चीज सक्सेस कर दिया. फिर दाहिना हाथ अपना लेना है जैसे सर बताए हैं, बस अब चालू कर देना है. किंतु उससे पहले इस मुंह में भी सब देखना पड़ता है, गुटखा या तंबाकू वगैरह
वही चीज है. हाँ इधर है, ये गुटखा बुटका खा के बेहोश हो जाएंगे. तो क्या है कि जो भी ऑब्स्ट्रक्शन मुंह के अंदर होता है वो निकाल देना. उसके बाद हेड टिल्ट करना. ये तंबाकू अंदर रख के टिल्ट करते रहोगे अंदर ही चला जाएगा. ठीक है, तो कुछ भी करना है बाहर, वो ऑब्स्ट्रक्शन कुछ मुंह के अंदर है तो निकाल के ठीक करना.
चालू करेंगे. सर ने बताया था 4 से 5 cm सर, और 5 से 6 cm, क्योंकि ये चीज जाके जब तक यहाँ अंदर वाला अपना हार्ट में जाकर उसको टच करेगा, तभी से टच करेगा तभी काम करेगा. उसके बाद चालू करना है यहाँ से.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26.
फिर चालू करेंगे. ठीक है,
ओके वेरी गुड. ऐसे नहीं पकड़ते, ऐसे पकड़ना नहीं चाहिए, नहीं तो ऐसे दबा के ऐसे नहीं, होल्ड करके ऐसे ही पकड़ने. दिस इज द वे यू होल्ड ए मास्क. इधर है नहीं, कभी जरूरत हो तो यूज कर सकते हो. फॉर योर नॉलेज आई एम टेलिंग. ओके, सो दिस इज द वे टू होल्ड ए मास्क. ऐसे दबा के पकड़ना, ऐसे करके रखना, ये सब अलाउ नहीं है. दिस इज द ओनली वे टू कैच ए मास्क. बिफोर आफ्टर टिल्टिंग द फेस और हेड लाइक दिस, ऐसे पकड़ते. देन द पर्सन हु इज हैविंग द एम्बू बैग, ही विल गिव द oxygen from here. That's why I told 3 persons.